Thank you, sir, and a very good afternoon to everybody. Today we are going to be discussing about management of dry eye in the cataract patient, and I'm sure all of us know how difficult it is to manage these patients sometimes, and sometimes it's more difficult to handle our post-op complaints of dry eye than it was to handle the cataract itself. So 25% of patients who visit ophthalmic clinics report symptoms of dry eye in some form or the other. So it's actually a very important condition for us as ophthalmologists and not only as cataract surgeons. And dry eye, we know, affects both quality of vision and quality of life. And it affects not only the quality of life of the patient, but also for us as doctors, because if they're not happy, they're going to keep coming back with the same complaints. Depending on the age, the incidence of dry eye after cataract surgery increases. So which means after a certain age, there's a very high incidence of dry eye in our patients after cataract surgery. And with the increasing population, we all know that we are going to be facing a lot of patients in the elderly age group who are definitely going to be bothered by very significant dry eye. And it is up to us to be prepared for this. So dry eye patient factors may include older age, female gender, and now very importantly digital device use, which is not only important in children or teenagers anymore, but across all age groups, because all of our elderly population is so dependent on our mobiles and TVs for passing their time because they don't have people to talk to anymore. So all of us are addicted to digital devices, so it's a very, very important thing to address as doctors. Environmental factors can include air pollution, allergens, and low humidity as well. A very important thing for us to be aware of is medications that the patient is using. We are quite tuned to topical glaucoma medications that may be causing dry eye, but sometimes it may be necessary to go back and find out the systemic medication the patient is on as well. So why is it really important to us? What can dry eye do to us, our patients, after cataract surgery? So preoperatively, just like Dr. Jeevanthiti, I'll just discuss, it can cause errors in placido-based topography, and it can cause increased higher order aberrations. So placido-based topography and keratometry is very important for us, especially in toric IOLs, where the axis we decide for placement of the IOL can be influenced by our biometry errors. And of course, we know that sometimes increased aberrations may be an important factor in deciding whether the patient is suitable for multifocal IOL or not, but most importantly, to make sure the patient is treated before cataract surgery so that he is not unhappy after a premium IOL. And potential concerns after surgery can be delayed wound healing. A lot of studies have been done to show the importance of using lubricants after cataract surgery and the effect the tear film can have on wound healing after surgery. So potentially infections, delayed rehabilitation. We are all very attuned to foreign body sensation that the patient complains of, and there is definitely a decrease in the quality of vision, which is very important for us to be sensitive about. So what happens in normal eyes, even without dry eye, after a blink, there is serial degradation in our tear film, which can affect our quality of vision. So you can imagine how bad it is in a patient with severe dry eye. The tear film is going to degrade, and sometimes that even before a blink, even before the patient's normal blink, the tear film may degrade enough to affect the patient's quality of vision. So this is a small experiment sort of thing I did when I was in Nanaiah Netralaya. So we took a normal patient, we put him in air conditioning and we checked his, we did a dry eye scan on him, and then the same thing we repeated after a simple drop of lubricant. So like you can see the point spread function, how much that dot is spreading is worse just by sitting in air conditioning. And after a drop of lubricant, it improves. So this is the difference the tear film can make to our quality of vision. So there are various ways in which dry eye can be precipitated after surgery. In cataract surgery itself, it may be because of transient spasm of the lacrimal gland due to the peribulbar block. It may be influenced and worsened by corneal incisions. Eye drops, we know, with preservatives will definitely worsen dry eye. It in turn leads to inflammation, in turn to increase osmolarity of tears, and in turn it can reduce pH, causing a lot of discomfort to the patient. It's very important to deal with these patients in a systematic manner, so to go through triaging, analyzing risk factors, and then maybe classifying the patient's condition and treating it. An attempt should be made to classify dry eye as aqueous deficient or evaporative, and it's important to try to find out the risk factors and the cause of disease. But quite often there is an overlap between aqueous deficiency and evaporative dry eye, so it's important to treat the patient in a more holistic manner. Examination can present as almost normal picture, or we may have severe staining in the cornea in many patients. But it's also very important to examine the lid and the conjunctiva as well. The lids, we know, the meibomian gland disease is very, very common in our patients, and it's very important to be sensitive about it and look out for it and treat it before cataract surgery. And we can also use diagnostic equipment to evaluate dry eye. Diagnostic scans are available, and we can also simply look at the autorefractometer, invert the lid on an autorefractometer, and use that infrared rays to see the pattern of the meibomian glands, to see how stressed they are. If there is dropout, in which case we know that the patient is going to continue to have chronic dry eye in spite of treatment. And it is also important to look out for conjunctival, lid parallel conjunctival folds or lip cough, or also, like we know, conjunctivochalasis. So this also is a reason for chronic dry eye, which the patient must be sensitized to before surgery. And it's important to check the status of the aqueous, and we can always use stains to help us make a better diagnosis. Fluorescein stain to look for tear film breakup time, or lissamine green and rose bengal to look for devitalized tissue. So we know that tear film breakup time is a very important indicator of the hallmark of dry eye. We've all done it, to evaluate dry eye. But now there are even non-invasive ways of testing for the tear film breakup time. OSA is one scan which can give us the tear film breakup time without having to stain the patient. And now there are a lot of equipment available to evaluate dry eye, because all of us are becoming more sensitive to this as a disease. We know that a healthy tear is not just aqueous, it's a complex mixture. It has antimicrobial proteins, growth factors, and cytokines. And we also know that altered tear film can definitely cause a lot of discomfort for us. There are ways to evaluate dry eye. It has been classified, and there are treatments available which are advised to us in a stepwise manner. We can always go back and refer to the dry eye workshop, and it's available for free online. But most importantly, we must know that there is no ideal tear film, ideal lubricant at this point. We have not been able to, simulate nature at all. So it's very important for us to choose lubricants depending on the patient's discomfort. And anytime we use an eye drop, a preservative-free eye drop is always better. Cyclosporin is an important drug in the armamentarium of treatment of dry eye, and it can really help in mild to moderate conditions. And it's very important to make sure the patient is doing lid compress, or treat meibomian gland disease with more than lid compress, either with LipiFlow or with intense regulated pulse light, which can help a certain group of patients who are not resistant to meibomian gland disease treatment. And then, of course, we have supplements like omega-3 fatty acids and oral tetracycline, lid scrub, and so on. So just to wind up, I think it's very important for us to be sensitive of dry eye in cataract surgery, before and after cataract surgery. And even if we are not sensitive to it, our patients will make sure they sensitize us to it, because they're so persistent to their complaints. And this is where I work. This is Coorg. All of you are most welcome to come and visit us in Coorg. Thank you.